action of calcitonin on bone and in kidney. Calcitonin, what it does basically, it is calcium.
In bone, lowers the blood calcium and phosphate by inhibiting osteoclastic activity.
Okay. That means it decreases the serum calcium level because it inhibits the osteoclastic activity on bone. And what about its physiologic action on kidney?
Increases the urinary excretion of calcium and phosphate.
Okay, very
probably
good.
by
Okay.
acting on the progenin.
Okay, so overall it decreases the serum calcium level. Okay, calcitonin. Okay, today we will talk about okay, as portion. So we'll be talking about the calcium. Okay, so calcium, whether it is a major element or minerals, there are minerals, right? So calcium comes under macro minerals or micro minerals. Hello.
Macro.
Okay, macro elements. Okay, calcium is the macro elements. And what is the dose of macro elements? You know? See, macro minerals or macro elements is if their required amount is more than 100 milligram per day, that is the macro elements or macro minerals. Whereas in case of the micro minerals, it is less than its daily. Okay. So coming to the distribution of the calcium within our body, okay, mostly 99%, about 99% of the calcium is present in skeleton, okay, and less than 1% is present in soft tissue, and about 0.2% is found in extracellularly. Okay, and total is about 1000 gram, that is 25 mole. Okay, so it is the overall distribution of calcium. That means about 99% is found in skeleton, that is, it is found in bone and teeth. Okay, so types of calcium, it can be present whether intracellularly as well as extracellularly. Okay, intracellular concentration, the calcium is very, very less. Okay, it is about one of 1000. Okay, 1 of 1000 that is present in extracellularly. In the extracellularly, calcium can be either in the form of the total calcium as well as the compressed calcium. Okay, total calcium means overall total calcium that is present extracellularly, free or ionized calcium. Okay, and in the plasma, okay, in the plasma the calcium is distributed either in the form of the free or ionized calcium. Okay, either it is in the next form, it is bound with albumin or globulin. Calcium level is 9 to 11 mg per dl. See. Okay, normal blood calcium level is within a very narrow range, that is 9 to 11 mg per dl. And intracellular fluid or plasma calcium, that is ionized calcium, and it is about 5 milligram per dl. Okay, and it is metabolically active. Okay, this free calcium is metabolically active and can be easily dissociated. And next is complexed. Okay, complexed with phosphate, bicarbonate, and citrate. Can you all hear me?
Yes, ma'am.
So what I said is calcium, it can be found within cells as well as extracellularly. Okay, I'm talking about the extracellular calcium. See, it can be in three forms. One is in the free or ionized calcium that is about 5 milligram per dl, and it is metabolically active. And next is the iron is complexed with phosphate, bicarbonate, and citrate. Okay, and it is about 1 milligram per dl. Okay, both of these form are diffusible from the blood to the tissue. Okay, both of these ionized calcium as well as the complex calcium, both of these are diffusible from the blood to the tissue. And next is protein bound calcium. Okay, protein bound calcium, that means calcium is mainly bound to the albumin. Okay, some amount is also bound to the globulin, and it is about 4 milligram per dl. Okay, and it is non-diffusible from the blood into the tissues. Okay, these are the three forms of the calcium that is found extracellularly. Understood? See, 50% is biologically active. It is free or ionized form. 40% is protein bound. It is bound with mainly with the albumin and some amount with the globulin. And 10% that is complexed with phosphate, bicarbonate, and citrate. Okay, this is the same thing. It is represented in percentage form. See, free or ionized is about 50%. Okay, and it is metabolically active. And protein bound is about 40%, and 10% is that is the complex calcium that is complexed with either citrate, phosphate, or bicarbonate. Okay, now coming to the sources of calcium, you all know milk is calcium. Okay, and the calcium content of the cow milk is about 100 milligram per 100 ml. Okay, and the medium sources of the calcium are the egg, cereals. Okay, they are the poor sources of calcium. Cereals like wheat, rice. Okay, they are the poor sources of calcium. So milk is a good source of calcium. Now the RDA, okay, daily requirement of the calcium for an adult is about 500 milligram per day, and for children is about 1200 milligram per day. And during the pregnancy and lactation, okay, lactating women, the requirement of the calcium is increased. That is up to 1500 milligram per day. Okay, and you all know after the age of 50, okay, there is more tendency for osteoporosis, okay, which can be prevented by increased calcium intake. In that case, you can give 1500 milligram per day plus vitamin D. Okay, those individuals who are above the age of 50, so you can prescribe the calcium of about 1500 milligram per day plus milligram per day in order to prevent the osteoporosis. Mechanism of absorption of the calcium. Okay, the absorption of the calcium mainly takes place in first and second part of duodenum. Okay, and absorption is against a concentration gradient. Can you tell me what do you mean by concentration gradient? Against a concentration gradient, what do you mean by that? Hello?
Lower to high concentration.
ATP is required for transportation.
Okay, ATP is required. Okay, 1 to high concentration. Okay, that means the absorption of the calcium takes place from the low concentration to the high concentration, and it requires energy in the form of ATP. Okay, and so for the absorption of the calcium, it requires a carrier protein. Okay, it requires a carrier protein, and it is helped by calcium dependent ATPase. Okay, calcium dependent ATPase. So it usually takes place in the first and second part of duodenum. Factors that promote, you all know vitamin D. Okay, can you tell me how vitamin D? Anyone? Vitamin D, how?
Calvin increase in protein.
Sorry?
With the help of protein called calvindin.
Breaking.
Okay, cal binding. Okay, can you tell me how the vitamin D bind with the receptor from the first step? Okay? Not just bind, that is Cal binding. Just tell from the beginning what happens when the vitamin D enters into the cell there.
Ma'am.
It's very important, so I'm just it will be revision for you all. Okay, tell me.
Your voice is breaking, ma'am. We can't hear you clearly.
Hello? Hello?
Yes, ma'am.
Hello? Now you can hear?
Yes, ma'am.
Okay. And, can you tell me what is the mechanism action of vitamin D in intestinal cells? Okay, vitamin D cells happen. Hello?
Calcitriol binds to the cytoplasmic receptors and forms the complex.
Yeah. And
this complex causes the transcription of calcium receptors. And there
see
is
what will
increase
happen?
in calcium receptors.
That is vitamin D response element that is present in DNA. Okay. First, vitamin D bind to its receptor that is present in the cytoplasm. Okay, and this hormone receptor complex then enters into the nucleus. In the nucleus, first it forms heterodimer. Okay, it combined with the retinoid X receptor, it forms heterodimer, and also bind with the co-activators. Usually, co-activators help in transcription. Okay, so it also bind with co-activators. Now there will be transcription. There will be formation of messenger RNA, and that messenger RNA is responsible for the synthesis of the protein that is calcium binding protein, which is also known as cal binding. In this way, this vitamin D helps in the absorption of the calcium from the. Okay, so next is parathyroid hormone. Okay, parathyroid hormone, it is indirectly helps in calcium absorption, right? We have already discussed. Can you all hear me? Still my voice is breaking?
Yes, ma'am.
Yes, ma'am, it is breaking.
Yes, ma'am.
Can listen, ma'am, nicely.
One is not breaking.
Hello, still my voice is breaking or it's okay? Still breaking? Oh God, what to do then? It's not clear? Okay. It's poor network here. Continue. I can't do because the problem is here in college. Okay. Acidity favors calcium absorption. Now it's okay or it's still breaking?
It's still same, ma'am.
It's still same. Oh God, what is this? Just to wait, okay?